Hey everybody, this is Dr. Clark Schierle with Northwestern Specialists in Plastic Surgery, here with 5 things that you may not have known about rhinoplasty or nose reshaping. So rhinoplasty, which is the reshaping of the nose, is a surgery we do very often here at Northwestern Specialists in Plastic Surgery. I'm actually a member of the Rhinoplasty Society, which is a specialized group of doctors from around the country who really are focused on and specialize in this particular procedure. It's one of my favorite procedures, a lot of fun to perform, very gratifying. It can really be life-changing when done properly by a board-certified aesthetic plastic surgeon. And here are 5 things that you may not have known about this procedure, because there's a lot of misconceptions out there in the community and online, and we're interested in trying to help dispel those myths. Here at Northwestern Specialists in Plastic Surgery, education is one of our most important missions, and that's why we have this YouTube channel, so we can help you be a better informed and empowered consumer. So, number 1, am I gonna have to have my nose broken? Are you gonna have to break the bones? This is a question we get all the time. Well, the nose is comprised of 3 different zones. The upper part is bony. The middle portion is made of stiff cartilage, kind of like your ribs. And the lower part is relatively soft cartilage, like your ears. In order to reshape the nose, if you do have a bump or a dorsal hump on the upper part of your nose, commonly known as the bridge, we call it the dorsum in medical language. If you have a bump on the dorsum, then as you shave that down, you can imagine your bone is kind of like an A-frame house. It sort of has this triangular shape. So if my hands represent my nose tilted up, as I shave down the upper part of that triangle, notice how it gets wider as part of that process. This is called an open roof deformity. Again, think of it as an A-frame roof, so as you shave down that bump, the roof gets wider and now it's open. So even if your nose isn't too wide to begin with, it may get wider, especially through this part, as we shave down that bump. When this is the case, sometimes we will use some very specialized instruments, they're called osteotomes, to gently cut along the edge of the bone. In this example, it would be where my wrists are. And by gently cutting along the bottom, we're able to then bend the bone down, and that allows us to close the open roof and restore a nice, narrow, aesthetically pleasing nasal framework. So this is what we do in cases when someone does have a wider nose or they have a bigger bump that requires widening the nose before we're able to close that open roof. And this is what's commonly known as breaking the bones, but it's not necessary in every case. So it's important to ask your board-certified plastic surgeon during your consultation if they think that'll be necessary, and it's not always the case. So if that's something that you've been afraid of, if you don't have this particular situation, you may be able to have a rhinoplasty without having the nose broken. Number 2, do I need to have any external scars? Well, even in the most severe cases of rhinoplasty, typically the only scar is going to be along what's called the columella. That's this portion of the nose right in the middle, this little thin section here. And so in most people, that scar is going to heal really well. It basically all but disappears over time as you heal. And during normal conversation, for instance, if you're looking at someone like I'm speaking to the camera right now, you can't really see that part of the nose unless you're standing lower than someone and looking up at the bottom of their nose very carefully. And that's not something that happens in most normal, polite interactions or normal conversations at cocktail parties. Maybe if you're really, really tall and everyone around you is much shorter, that might be a situation where that scar is being looked at more frequently. But even then, it tends to heal so well that it's pretty much invisible to the naked eye. So there are situations though where we don't actually even need to make that scar at all, and you can have no visible scars on the nose whatsoever. This is called a closed rhinoplasty. Many of my patients who suffer from internal airway obstruction, from breathing difficulties with a deviated septum, or bilateral turbinate hypertrophy. The turbinates are these structures on the side of the nose that can sometimes be overgrown and help block the airway. If all you're doing is helping correct airway or breathing issues with a septoplasty or turbinate reduction, these are things that can be performed with completely hidden scars that are all inside the nostrils. In addition, for me personally, if I'm not doing a lot of work to the tip, so some people will have a tip that's pretty well proportioned and it's in the right location, but they really just have an isolated bump on the upper part of their nose. Well, we can definitely approach dorsal issues or issues on the bridge of the nose without creating that scar. So In selected cases, we are able to perform nose reshaping and nasal airway improvement without creating any scars on the outside of the nose. So if that's something that concerns you, it's something definitely to discuss during your consultation with a board-certified plastic surgeon, and you may be able to avoid those external scars under select conditions. Number 3, packing. Now this is something that drives patients nuts. Having packing inside of your nose for a week or longer after surgery is not something that anybody is going to enjoy. Thankfully, the vast majority of cases that I perform do not require any internal packing whatsoever. This is typically required by some surgeons when they perform a septoplasty to provide a little bit of support for that septum. Instead, we use internal stitches, quilting stitches, to help to compress that septum and give it some shape so that it's able to avoid the packing, which is really, really uncomfortable. And so we understand that. We recognize that this is one of the most uncomfortable parts of the recovery. And so we've really done what we can to learn some more modern techniques that allow us to avoid nasal packing. I pretty much will only use packing if I feel like the external framework or the bones of the nose are so unstable. For instance, in a recent trauma case where I'm unable to provide the kind of shaping I need after the surgery with just an external framework alone. And so that's when I'll use an internal packing, but that's very rare. I use nasal packing on fewer than a handful of cases every year. Bruising. Am I going to have a lot of bruising? So this speaks to the downtime issue. Most patients are afraid they're going to have lots of bruising. With more modern techniques that we utilize here at NSPS, we use a lot of local anesthetic, even if the surgery is being performed under a general anesthesia. And with these modern techniques and delicate tissue handling, we are most often able to avoid any bruising whatsoever. So I'd say the vast majority of my patients will experience little to no bruising. Whatever bruising you do have, which may present as a little bit of a hint of a dark eye, that's going to typically last about a week or so. And so most patients are going to be more than ready for public viewing and social activities about a week after their surgery. 1 week is typically also when we would remove an external nasal splint, which is a little structure on the outside of the nose to help provide support after the surgery. And so typically 1 week is when we tell patients they're going to be able to socialize and be in a situation where they wouldn't necessarily want someone to know that they had had this procedure. Finally, how long does it take to recover from the surgery? I've heard that it takes a year to recover from rhinoplasty. Is that true? Well, there are several phases to the recovery process. You're going to have some pain for maybe a day or two. This turns into more of a soreness after that first day or two, and most patients are going to be sore for a week or two. It is true that it can take up to a year or two for all the swelling to resolve. Now, this doesn't mean that you're not going to be able to go out in public and that you're going to look weird. It's simply the fact that on the nose, because the skin is so thin and the nose is a relatively small structure, that 1 millimeter of swelling may be noticeable on the nose, whereas it wouldn't be on your tummy or on your breasts. And so because 1 millimeter may mean the difference between the bump on the bridge of my nose is improved and my nose is straight now, or the bump is still there and I'm still not happy, most people are not going to see the final results of their surgery for up to a year. That 1 millimeter of swelling can take up to a year to completely resolve. The way that we perform rhinoplasty is safe. It's based on sound principles that we've learned through years of experience, as well as from my colleagues at the Rhinoplasty Society, at the meetings that I attend and lecture at. And because of this, we use time-proven methods, which we know are going to hold up well over the next 5 years, 10 years, 20 years. It is absolutely true that using these techniques, many of our rhinoplasty results will look even better at 5 years or 10 years. And we are really doing surgeries that are natural, that are built to last. Other thing to recognize in terms of the 1 year is that you do look very normal. And these are things that you may notice and that I, as your surgeon, may notice. But most of these little issues are not going to be really noticeable to the naked eye, to the untrained people around you, your friends and family and so forth. In fact, if you do have a bump on your nose that we're correcting, and you do have a little bit of swelling that replaces that bump, which takes up to a year to go away, if you are trying to not reveal the fact that you've had the surgery to some friends and family that you haven't seen in a while, it is possible that you will look much more natural and that your recovery will be so natural that no one will really even notice that you've had the surgery done. And this is something that many of our patients do appreciate in terms of the discretion and privacy issue. So that's 5 things that you may not have known about rhinoplasty. I hope that helped to educate and inform you and make you a better, more informed consumer. Surgery is really a big deal. We take it very seriously. We expect our patients to take it very seriously. And an educated consumer is our best patient. Hopefully that was interesting to you. If you have any thoughts, comments, questions, other things that you'd like to know about rhinoplasty, please leave a comment below. Make sure to subscribe, click that bell to be notified when a new video posts, and we'll see you next time.
Hey guys, thanks for watching our video. Make sure to subscribe, follow us on Instagram, Facebook, and Twitter, and check out our next video.